And so what's in it for the health systems? I mean, intuitively, it makes sense to me that there's a reliable revenue stream through the patients that are coming in through these employers, but maybe you can expand on that.
It is a great reason right off the bat, right? You want an assured volume that you can trust coming in, because it's up to your own performance and your relationship with that employer to make it work. It does take organizational commitment here. And I mean, we can't underestimate that, both for the employer and the hospital, to make this work. It takes organizational commitment to not only have the program, but to continuously improve that program and grow it if you can. So we talked about some of the risks here for the hospital or the health system. If their cost structure is way high and they're never going to be competitive, man, transparent data is going to make that very apparent to everybody in the market. So you really need to understand where you sit with your competitors. And if you can play in that game, you don't have to deal with a lot of the complexity that health plans and network arrangements through health plans have in terms of billing and denials and underpayments and delays and so forth. Really, what you're talking about is you just need a third party to process the claims that are already agreed to. So there's some sort of administrative complexity over the revenue cycle, the billing process. It goes away, not entirely, because you're still dealing with third parties to process claims, but the games that health plans play for denials and so forth, those go away.
So overall, you would say the administrative costs on the provider side with managing these direct to employer relationships is less than the administrative costs with dealing with utilization management, prior auth, back-end denials. It's less cost to the hospital.
That's a great summary. Absolutely, completely agree with that. Completely agree with